Here I am. I had to stop recording because it wouldn't let me see myself speaking with you. And I wanted to see what the heck I look like. How do I look? Anyway, day one is the hardest to talk about. Day two is still challenging, but you know, we're in the thick of it and we're comfortable, at least knowing where we are in the hospital and, getting around and Ben Ben is in the hospital. Graham and Raymond came and visited. Graham's having trouble staying in the room. He doesn't like the hospital very much, and I understand that. I've been taking breaks and going out in the grass, even in the hospital. On day two, I would take a break when they were there with him, Graham and Raymond, and I would just go far out and sit in the grass and feel the sun on my face, try to soothe myself. The elements and the earth and the stars and all of that are so incredibly soothing. I have really, really gotten serious about taking care of myself and using all the tools that I know, and some of that is getting up and doing yoga. I wasn't able to do it in the hospital, and it's so helpful. Like, I get up every morning now and I do my yoga, and I do meditation every day, sometimes twice a day now, because it's so imperative. It's so helpful for me to raise my vibration a little bit, raise my spirits, and ask and intend for what I want for myself moving forward. But on day two, I'm in the hospital, right? So all I'm doing is going out from the hospital a little bit to soothe myself. And they're talking about on day two, well, we can't take the intubator out until he we can be clear he could breathe more on his own. But they can't be clear about that because he's like out of it. They're giving him so much stuff. They're giving him fentanyl is one of the things they're giving him. And I know that it has a really bad rap right now, and I know they're probably using it in a good way on this second day, but he's just totally out of it. So how do you check his breathing and stuff on his own if he's out of it? So they had to bring him out of it some, and then he pulls on his all of these needles that he has in his arm that are feeding him whatever they're giving him, the fentanyl and the other. There's another one that's a pain thing, because it's probably very uncomfortable. So we really can't talk with him on day two either. He's just out of it, and they're talking about what they're going to do, but they haven't really done anything to take it out. So it's still really just a waiting game. So, trying to navigate how to be okay in that hospital place. And they have gifted us on day two with someone called a sitter. And this person, or individuals that change out every 4 or 6 or 8 hours, sits at the door because Ben is considered a flight risk, even though he's in a bed and out of it. So this person is watching us and making notes and making sure, I guess, he doesn't leave. But it kind of really feels like, I don't know, what do I want to say? It feels like they're monitoring us, like, I don't know. It feels invasive. It feels like we're criminals in some way or whatever. And I know they have their reasons, but it's just sort of uncomfortable. You have this person you don't know, and they tell you who they are, their name, but they're just sitting there staring at you and making notes. So I'm not really delighted about that. Apparently, the psychiatrist came, and she and her colleague talked with me a little bit, and they were just saying, like, This is just the protocol, you know, and we're going to admit him involuntarily to the hospital with the psych ward when he gets out of here. And, you know, they're not really soothing very much, and they're telling, I mean, the doctors, the nurses, everybody, they're just telling you this is the way it is. And I know they're all, you know, following their protocol, and they're all doing their very best, and really they're very kind, service oriented people, but it felt like to me more uncomfortable, more of an interrogation than it felt like, you know, hey, we're here to help you, especially with the psychiatrist, you know. I'm giving them information about him, and it's really not forthcoming in any way as far as like how this is going to look. Really, they're just saying this is the way it goes. So I don't know, I don't want to be disparaging of these people, but I feel like there's a way to do this in a more heart-centered way, and it's on day 2, it's just very confusing, and it doesn't feel like people really care about him as an individual. They sort of, he's just a patient, and this is what we do. You know, when this happens, this is what we do. And it seems like, I mean, I just had a day 2 with him, and it just seems like when I was with him, I was just there to be the soothing one, the source of love, and holding that space for him constantly, even throughout the night, because really can't sleep there. And, or I couldn't anyway. I couldn't really still, I wouldn't leave his side. Like, I wanted to keep my hand on him for some reason, and just like, I kept trying to hold the space for the most positive outcome that could happen. And I mean, that felt good to me. You know, this is all I can do, so this is what I am doing. And that's what I did. Day 2 was kind of a just more immersion in the hospital, and a lot of loud and, you know, patients crying out, and it's just really uncomfortable. And of course, you know, we can't really talk with Ben yet at this point, so, you know, we're just being there with him. So I spent the night 2 there, and I didn't sleep very much at all. Kept my hand on him, sort of put my chair next to his bed. Yeah, not much sleep. I'm getting kind of haggard at this point, and I haven't showered, I haven't left the hospital, so at this point. And so anyway, that's day 2, and I'll share some more with you about day 3 tomorrow. Thanks for watching.